Hi, good afternoon. This is Risha from the Alliance Trinidad office. Hi, is Paul Johnson in office?
The thing kind of bam bam. It was all Jamaican, really different style, different fashion. You know? Tell me say one thing, Nancy.
CHAA has been in the Caribbean since 2003. Initially as a country office, as part of the International HIV/AIDS Alliance. We have since then transitioned into being an independent organization. And that took place just recently. That took place in December of last year. So there's real excitement about that. And also the opportunity that brings out for CHAA to be independent, strong, indigenous organization.
In the past 2 years, Alliance has grown a lot. When I came here, the staff strength was only 16,
Yes, I am.
and now it is almost reaching 32. Funding wise also, last year we got a new project from USAID. It's a $12 million project, and it is for 3 years. So funding wise also, I have seen Caribbean HIV/AIDS Alliance growing very fast.
We are unique to a lot of the Alliance family offices globally in that the Caribbean HIV/AIDS Alliance is a regional organization. So we have representation from St. Vincent, from St. Kitts, from Jamaica, from Barbados, and so forth.
So when we go from one country to other, there's the assumption that we can move, because it's called the Caribbean, that we can move from Trinidad to Jamaica and operate the same model. Well, actually, we know we can't. So what we do in Trinidad doesn't necessarily work in Jamaica, or doesn't necessarily work in the Eastern Caribbean, say in St. Vincent, for instance. So that's where the difference is, that you constantly have to adapt your approach to, although it's in one program, to respond to the different country needs.
You begin to really appreciate that program delivery is not what we sit down on paper and articulate, but program delivery is essentially the model, the theoretical model, plus the contextual social issues or context of that particular community merged into one being implemented. And the success of that program is very much dependent on how the balance is met between the two.
Never trouble no one. I'm a lady, I'm not a man. MC is my ambition. I come free nice.
Our intervention strategies at the moment is quite a wide range of interventions. It varies from direct intervention with key population, in particular men who have sex with men, sex workers, and people living with HIV and AIDS. And that intervention might be through the provision of IEC material, through direct one-to-one pair group intervention, strengthening CBOs through the provision of onward granting. So therefore we provide specific grants to community-based organizations, which enables them to build their capacity, strengthen their governance structure, and have the ability for them to be part directly in the response to HIV and AIDS in their community. So therefore, at the end of the day, it's not us who's doing the intervention, it's that we strengthening the communities.
We've got 2 onward grants that we're in the process of hoping to roll out. One is with Gender Affairs. Gender Affairs is an organisation which is government run, but it's incredibly progressive, and it works very closely with women who are affected by domestic and gender-based violence. And the program that they've developed is really to work with the police to sensitise them around sexual violence and the cause and effect of HIV that would have.
No, no, no. You don't love me, and I know now.
The peer-based model that CHAA uses that's why it's the cornerstone of our work. Accessing groups who experience huge levels of stigma is a lot easier if the person who comes to that other person says, well, hey, I carry this burden with you, and I can share your experience.
I suppose tribute has to be paid to our animators program, because the animators is in many ways is the front line. You know, it's the front line of our program, because it's where, you know, people are going out at 9, 10, 11, 12 at night in hot spots, in places where no one goes to, in places which are hard to go areas, are accessing people that really would not come forward and do not feel confident to come forward, and worst of it, don't want to come forward.
We've been training our animators. Our animators have gone through a number of behaviour change communication trainings. They learn about participatory learning techniques, and we're also going to use our animators when we roll out the rapid testing for HIV and AIDS. They will be trained in how to do the tests. The tests will be done in the community, and they will also be trained, they are already trained on the counselling aspect of the testings.
Oh, na, na. Yeah, na, 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 yes. Yeah.
One of the projects of the Caribbean HIV and AIDS Alliance seeks to increase the uptake of the use of female condoms among commercial sex workers, so that women will have a device that is within their control for use.
The core vision of ECCAP and CHAA in this program is really to give a voice to marginalised groups and to ensure that they're able to protect their sexual and reproductive health rights. And it's really exciting to work with people that are from those communities and know the issues, because, you know, I learn from them every day, and that's for me the most exciting part of the job.
I think the Alliance's work has been very much community driven, and that is what I love about it, that, you know, we're essentially working side by side with the community to make sure that, you know, their dreams and their issues are met with whatever assistance that we can provide. So it's a parallel approach as opposed to a top-down approach.
We're also able to address more difficult challenges that such groups face, such as in relation to stigma and discrimination. Through the work of the Alliance in empowering these communities, we're able to create the advocacy and to help them also develop their own community empowerment strategies, so they too become more empowered and are able to better advocate for changes that will bring positive improvements to their lives.
The generalness about raising awareness of the needs for people to know their result, the need for people to change their behavior in terms of safe sexual practices. You start to put that as a package that one organization is involved in. Then you start to measure the level of impact and the depth of impact that the organization has had in the region. What we need to do, I think, is to blow our trumpet a bit more. We're not very good at blowing our trumpet. And if we did, I think we'll surprise ourselves in terms of the range and type of impact, nature of the impact that we've had in the region.
The thing kind of bam bam. It's because all Jamaican, really different style, different fashion. You know? Tell me, say one thing Nancy can't understand. One thing Nancy can't understand. What make them a talk about me ambition? Say what make them a talk about me ambition? Come and say some of them a ask me where me get it from. Just some of them a ask me where me get it from. I told them no, it's from creation. I told them no, it's from creation. Bam bam.